Hello, friends. This is your friend and host, Suren Arora, once again back with you. I try and be around the same time, but in between some calls comes or something comes. Most of my friends know me as an astrologer and a hypnotist. Those who may be viewing my video for the first time, I am an astrologer. So, palmistry, numerology, aura science, Vastu Shastra, astrology is, like it covers almost all the part of life. The reason or the logic behind the astrology is that we need to have a peep in the future. The logic is that if we know the future, then we can, or if we have an idea about the future, then we can plan it accordingly. If we feel that there are tough times, then we can like gather some strength and touch. And if we feel that the times are good, we can take advantage of it. I am also a hypnotist. I do a lot of behavioral therapies. I do couple counseling. I do motivation. Habits like smoking or drinking or many other things like that. You can ask me through this platform or maybe through my personal messaging. How can I help you? I'll be more than glad to help you. We will continue the journey of vitamins, friends. There are three vitamins remaining that we have covered few vitamins yesterday. Today we will cover D, E, and K. And from tomorrow onwards, we will be talking, or I will be talking more about a subject that is very dear to us, or people may like to hear me on, is how to lose weight. So, how to lose weight, how to lose fat. Some people don't need to lose weight, they need to lose the fat. And some people only need to do lose inches. They don't need to lose any weight or anything like that, nor they need to lose anything else. They just need to tone up their inches. So we will have a series of topic on that. And before I talk about the vitamins today, let me remind all of you that I am not a medical professional. I am not your family doctor. I am not a registered health practitioner. So whatever I am sharing with you is my information and my opinions and whatever I have learned. Your family doctor is your best friend. In case you have a health issue or you want to change anything in your life, then you better have a discussion with your family doctor. That's something that I must say, and I must make something very very clear. So yesterday we talked about A, B, and C vitamins. Today we will talk about D, E, and K. And in the meanwhile, I would also like to thank you, everyone. I'm getting a lot of response. Most of it is in my private messages, but doesn't really matter. Feel free to ask. Feel free to talk. Feel free to appreciate also, and feel free to share also. Your appreciation doesn't get me any money, or your liking doesn't get me any money, but it gives me motivation. Once again, let me remind you, I'm a motivational expert myself, but then I do motivation too. So tomorrow we will talk about weight and fat, but for today we are talking about vitamin D, E, and K. So let's start that. Let's start with the vitamin D. To my mind, in my opinion, vitamin D is the most important one, right? Vitamin D deficiency can like create a havoc in our life. It can hit our bones in a negative way. Now, what are vitamins? Now, vitamins are the substances that our body needs to grow and develop normally, right? Now, what is the role of vitamin D? Vitamin D helps the body to absorb the calcium. So no matter how much calcium you are taking, if your body does not have vitamin D, then it cannot absorb the calcium, whether you are eating or having calcium through the food, or if you are taking any calcium tablet. Most of the times you will see that, like those medicines or supplements that are being sold in the market, you will see on their label it says calcium and vitamin D. The reason is, without vitamin D there is no point taking calcium, so keep that in mind. Calcium is one of the main building blocks of bone. Bones are made of, like, largely made of calcium. So calcium is very, very, like, important, and so is the vitamin D. So what happens if we are short of vitamin D? We can have a lot of bone diseases. Osteoporosis is one, rickets is another, if you have heard this name. Vitamin D also has a role in your nervous system. Mind it, your nervous system depends on vitamin D. So when you are low on vitamin D, you may feel irritated, you may feel angry, you may even lose sleep, right? Vitamin D also has a role in muscle building. So those who do gym or those who do exercise and all, they must know that they require vitamin D, because muscles require a vitamin D. Another very important aspect of our life that requires vitamin D is our immune system. So once we lack vitamin D, our immune system gets weakened. So now I hope you understand why vitamin D is so important. Now, friends, how do we get vitamin D? Let's say, how do we get it? So we get it in three ways. And please note down three ways. One is from the skin, light, sunlight. Sun is giving us vitamin D, the major source. But how about people living in Canada like me, who doesn't have vitamin D around or the sunlight around? What do they do? So the second source of vitamin D is through diet. Vitamin D rich diet. The third is, which is like very common with all of us, is through supplements. Now let me remind you, any supplement or any vitamin that you do overdose is not neutral, it harms you, right? So stay away from overdosing yourself with any vitamin whatsoever, right? Now, you need sunlight for vitamin D, right? But always remember that too much of sun's exposure, like, let's say, just because you are short on vitamin D and you are spending too much time in like in sunlight, too much sun exposure can lead to skin aging as well as skin cancer. So beware. Like, as I said, overdose of anything and everything is harmful. So try and balance it. Have it from the sun, have it from your food, have it from food means the diet, have it from the supplements also, right? Now, talking about food, what is it that has vitamin D in it? So the first thing that comes in my mind is egg yolk, right? Saltwater fish, liver, right? Milk has it. Some cereal have it, like they have added vitamin D in it. So who can answer your questions about vitamin D? What is good for you? Check with your healthcare provider or with your doctor. Make an informed decision. Now, there are a few groups of people who require more than usual vitamin D supplements. Who are they? So the first is the older adults, right? They are the one. The next one are breastfeed infants, because their bones are building, so they need vitamin D. People with dark skin, because the dark skin, you can't absorb much from the sunlight, so you require vitamin D more. People who have certain medical conditions, people who have liver diseases or cystic fibrosis, um, something like that. People also who have obesity, they also require more vitamin D, because their bones need to be strengthened enough to take their weight, right? Or anybody who has gone through gastric bypass surgery also need vitamin D or more of it. So now let's talk about vitamin E. Right, E for England. I think all of us, like especially females, must be aware, or females are fond of vitamin E, because it does such a wonderful job whereas the skin is concerned. Now, once again, what are vitamins? Vitamins are important substances that our body needs to grow and develop normally, right? Normal growth is necessary, right? So vitamin E is an antioxidant, right? It plays role in immune system as well as metabolic processes. So any metabolic process in the body, it requires vitamin E, right? So where is vitamin E found? First source is vegetable oils, right? Another source that you may find in your house is margarine, right? You get plenty of vitamin E from nuts and seeds. Another important source is leafy greens. You can go to any food store, Loblaws, or there are so many. So you can pick up leafy greens. Vitamin E is also added to food like cereals, which are available. Right. Most people, most of the people get enough vitamin E from their diet, unless and until they are eating too much from outside or they are junk eaters. People who are suffering from liver disease will be getting benefit from vitamin E. And vitamin E can be dangerous or can be harmful for the people who are taking blood thinners. Vitamin E is harmful for them. So consult your doctor or ask your doctor that I am taking blood thinner also and vitamin E also. Is it right? Once again, reminding you guys, anything wrong, anything, your food and your vitamins must not clash. Your medicines and your vitamins must not clash. So check with your doctor or healthcare provider for taking any supplements, because you may be trying to do good to yourself, but then it can backfire, and it can backfire badly. So now let's move on to vitamin K. In between, viewers who have just joined, let me remind, we will be talking about weight loss from tomorrow onwards. So there will be a long chain: weight, fat, and inches, right? So let's come back to vitamin K. Now, what are vitamins? Once again, vitamins are the substances that our body needs to grow and develop normally. So what does the vitamin K does, right? The vitamin K, what it does is it helps our body by making proteins for healthy bones. So what makes protein for our bones? It is the vitamin K. What makes protein for our tissues? Vitamin K. That is why it is very, very important. It also makes protein for blood clotting, right? If you are low on vitamin K, the blood will not be able to clot, and what will happen is you will bleed too much, because the blood has thinned down so much. Every time you have a cut or something, you will be flowing blood. Why you will be flowing blood? Because you are low on vitamin K, and therefore blood cannot be clotted, right? Newborns, friends, once they are born, they are they have a very little vitamin K, and most of the times, at most of the places, they usually get a shot of vitamin K soon after they are born. Now, if you are taking vitamin K2, you have to be very, very careful when you are taking any blood thinner medicine. I cannot stop myself repeating time and again, your vitamins should not clash with your medicines. Your doctor is your best friend, it can tell you. So people who are taking you are taking blood thinners also as medicine, and they are taking vitamin E also, and they are taking vitamin K also, will be doing a lot of damage to themselves. Vitamin E can interfere into the body as to how the vitamin K works. So these two clash, right? Vitamin E and vitamin K, they both can interfere with how each other works in the body. So be careful about just picking up any supplement and going for it. Ask your doctor. There are different kind of sources from where we can, and there are different kind of types also of vitamin K. Most of us get vitamin K from plants, right? Green vegetables, or any dark color of berries. People who don't eat vegetables and who normally survive on junk food need to worry about it. Bacterias, and you will be surprised to hear this, bacteria in our intestines also produce small amount of another type of vitamin K altogether. So this was the journey, whereas vitamins are concerned. We will be talking or taking more health subjects. I will be joining you with more. Meanwhile, feel free to ask questions. Also, feel free to appreciate or give me a thumbs up or give me a like. Your appreciation is important to me. I am also a human being, and all of us require appreciation. That would also make me say that always appreciate people, anyone, everyone. Stop seeing the dark side of life or the dark side of people. There are two ways of looking at life. One is there is a night between the 2 days. There is a long night between the days. The other way of looking at it is that there are 2 days between just one night, 2 bright days. So life is how we look at it. If you are curious about, or if you need more tips, let me know. I will be glad to share my expertise, my learning, and everything. We can share notes, and then later you can check with your doctor. I cannot thank you enough. I cannot thank you enough for all the support, all the love, and all the affection, all the attention that I have been getting. I invite people to talk more. Sometimes what happens is you are talking, you are dealing with your anger. Sometimes you are dealing with your depression. Sometimes you're dealing with some emotional issues. And sometimes we end up blaming life or other people and our emotions for it. And sometimes the only cause lies within the food that we eat. We don't eat certain vitamins, we don't eat something very, very important, and we suffer emotionally too. So I will say goodbye for today, and thank you very much. Tomorrow, don't forget to join me, weight loss. Thank you.